Hello, everybody. Today we are covering dental health and teeth. So, this might be a pretty jam packed episode. We have a lot of stuff to cover, and I'm really looking forward to it because I plan on using a lot of these things. So, where to start,
Yeah.
Melissa?
Where to start? So this is such a great idea. So many people ask me about dental health and can homeopathy heal cavities? And what can homeopathy do with dental health? So I want to start with if you catch a cavity early and it's really small and you use diet and homeopathy together, the enamel can grow back. You can heal that cavity. But that's not the case with most people. Most people catch the cavity later, it's bigger, and it's likely too late to heal it. And you really do need to use diet and food along with the homeopathy to heal the cavity. So I want to start with that. Most dental issues are structural, and you need to go to the dentist. And so homeopathy is not magic. It's not a cure all that's going to fix. If you need a root canal, homeopathy is not going to fix that and cause you not to have a root canal, but it can buy you time.
Hmm.
And I have seen it heal nerves. So if you're having nerve pain, and we'll get into that in a few minutes, then it can, more than just buy you time, it can heal those nerves. But we're going to get into all of those things. And then really where to start is investigate. You need to know the right questions to ask your homeopath, I'm sorry, you need to know the right things to tell your homeopath. But first, let me just say that, talking about dental stuff, your mouth is a window into your overall health. Most disease starts in the gut, but about 90% of diseases will manifest themselves through some sort of oral health symptom.
That's
So that's a
so
big that's a big percentage.
interesting. I have been wondering about this
Uh,
because I have my first cavity. I know I have it, I can see it.
Now,
And
okay,
yes, and that is so this is something I have dove into in the past because I've known friends with children with severe tooth decay. Part of it I know is genetic. And I've joined a few Facebook groups, and people who are super committed have really healed some crazy things. But like you said, there's a laundry list of supplements, homeopathy, diet changes that they've made that I feel like is very unrealistic for my life. So I'm trying to figure out the balance of how to still take good care of my teeth. And I think it's a sign that I need to do better. I had 3 kids close together, chewed a lot of ice, did probably not eat very well. But how do I know if it's a big cavity? So would you, sorry, I know I'm kind of going backwards a little bit. How do we know if
it's
it's a
okay.
big or a small cavity that can be managed without going to the dentist? Or would you say go to the dentist, get it checked out, get maybe an opinion, and then go
So
from
if
there
you
and
know
how
you
to
have
go
a
forward?
cavity, I would start anyway. Just get started on the calc floor and the calc foss and the things that we're going to talk about and the silica. But and we'll get into detail about that. But then yes, go to the dentist. And you need to have a dentist that you trust, right? I had an experience at a dentist where they told me I had this big terrible thing, and I believed it. And for different reasons, I went to a new dentist, and I asked that dentist. Well, I didn't say a word. I didn't have my records transferred. I didn't say a word. I went through my cleaning process expecting them to say the same thing. And when she didn't say anything, she was like, okay, you're all good. Let's go. And I was like, wait a minute. what do you think about my gums? Do you think I have any gingivitis or anything? She was like, no, not at all. And this other one was like, your gingivitis is so bad, you're about to be in periodontal disease. And I was scared to death. I was like, I can't believe this is happening. I don't even have any symptoms, but I still believed it.
Mm.
So, okay, so there's that. So you gotta trust your dentist,
Yeah, which
and
is hard.
they're not just gonna tell you it's a huge cavity that you have to get filled. So that's the first thing. So yeah, the dentist, I believe, can tell you, and maybe you can even ask them to show you. So if they're taking X-rays, which, by the way, I do want to say very quickly, without going into great detail, the digital X-rays at the dentist are minimal compared to getting on an airplane. So people are super worried about getting X-rays at the dentist, but if they're doing digital X-rays, the exposure that you get is a lot less than just riding on an airplane. So I just
Interesting.
want
Okay.
you to be encouraged not to be super worried. I don't worry about it. We have, because of insurance, we get our dental X-rays once a year, and I don't worry about it.
Okay.
And maybe I'm wrong for that, and you can take that or leave it. But
So you were saying that you were talking about the connection between our mouth, our oral health, and the rest of our body. So what are would you say cavities, whatever you said about the gingivitis, that's what you said. Are all of
hmm
those
yeah,
typically signs of deeper things?
yeah, oh yeah, for sure. And that's part of my intake form when I take a chronic case. I want to know how your dental health is. I want to know how many fillings you have and what kind of fillings you have, and have you ever had a root canal. All that is to help me see your overall health, because we need to know those things. So, so teeth problems in children can often come from bottles. If they're and I think we've known this, everybody knows this. If you're putting your child to bed with a bottle or a cup, that can cause tooth decay. um, but also some children will lose teeth too early, so that's a sign there's something going on here in this child's health.
So even if they're not
Babies,
decaying.
children's right, right, that's right. If they're coming out too early,
Okay.
if they're not falling out at all, if they're holding on to those teeth, and the dentist is having to pull them because the other teeth are trying to come up, that's an
Okay.
indication. Crooked teeth is an indication of something. Now, I also do believe that, the Weston A. Price Foundation talks about how our structure has changed because of our Western diet.
Mm,
Well, where our jaws used to be wider, and because of the way we eat, they become more narrow. So there's not enough space in there. So that's different. If it's structural, if you have a narrow jaw and there's crowding, then it's likely due to that. Cavities, tooth discoloration. So if they're yellow, gray, those different colored teeth, that's an indication of something wrong.
so something I've looked into also is the effect that tongue and lip ties can have um, on your oral health, on tooth decay, especially in little babies. You notice it more because milk is really sugary, even breast milk, and it gets stuck up there. Or they can't use their tongue. Even adults can't properly like clean your molars or your mouth with your tongue,
Yeah,
and so that can also play into tooth health, which is
yeah,
genetics, I guess, typically.
right.
But that's also kind of a
Yeah.
deep dive in another direction.
Well, yeah, and so I'm glad you brought that up, because I am planning an episode in the future about tongue tie and structural things and how to really handle that in babies. But also, speaking of adults, so tooth problems in adults that you would look out for that would indicate problems, of course, are cavities, cracked or chipped teeth. Because if your teeth are okay, so if you're drinking from a glass and somebody bumps you and that cracks your front tooth, that might be a little different than if you're just eating food and you're just noticing
Mm.
cracks and chipped teeth where it really shouldn't be. Stained teeth, abscesses, excessive plaque buildup, impacted teeth, and bruxism. So that can be in children or adult, but grinding your teeth. Those are all indications of a deeper problem. And prevention is really your best route to take. So, um, all dentists talk about hygiene and daily brushing and flossing. I never used to floss. I know this sounds really gross to some of you out there, and I hear the dental hygienists making fun of people who don't floss, that when they go to clean their teeth and they're picking chicken out from 2 weeks ago. I didn't used to floss. I didn't, right? I didn't see I don't know what it was. I didn't understand the true benefits. So if hygienists or dentists are listening to this right now, I would encourage you, if you're not already, to really educate your patients on why. Because I don't think I ever was. It was just, you need to brush, you need to floss. And that's all I was ever told. I'm a type of person, if I don't know why, then I'm like, I
Yes,
might not
I
even do
agree.
it because I need to know why. So I have flossed every single day for the last, I don't know, 3 to 5 years or so. Huge difference in my dental health that I've seen. But on top of brushing and then flossing, I use this mouth rinse called by Triology. Triology. Look that up. Amazing stuff. Love it, love it, love it. And I rinse with that after I floss with Cocoa Floss. So that's the name brand, Cocoa Floss, COCO. And those are my favorites. So Cocoa Floss comes in all kinds of flavors, and I just like the mint. That's just the one that I love. So
I'm looking
you
all
need
these
to
up right now.
be brushing. Yeah, you need to be brushing and flossing. And I do highly recommend the Triology rinse.
And can you use that rinse for kids, do
And
you
then
know? Like if they
I do believe
accidentally
you
swallow
can.
it?
I think it depends on what. So look at the ingredients. All natural stuff, all very good stuff. If they
Okay.
accidentally swallowed it, I can't remember honestly because my kids are older. So read
I'll
about it
look
on
at
the
it.
website.
Yeah.
Yeah. And so then also diet and nutrition. I mean, everybody knows that, right? Listen, right now, when I eat sugar, so I go through these phases where I eat a lot of sugar and then I'm just like, this is ridiculous, stop it. And so I just stop eating sugar. When I'm eating sugar, my teeth hurt.
I
And
have
it's
so
not because sugar's sitting on my teeth.
since I have this cavity and I have been paying more attention, if I really listen to my body, I don't even want sugar like I used to. I mean, I have a big sweet
Nice.
tooth and like dessert, even drinks.
Yeah.
I will naturally feel my body not, I just don't want that. Doesn't sound good to me. And I notice my teeth they like ache, which means they're not
Yeah.
healthy. I've never had that issue before. I've never had a cavity ever. But
Yeah.
until right
Yeah.
now,
That's so
and
cool.
as you're as we're talking about this, this is probably like dental health 101 or just teeth 101 maybe. But I think we mostly live as if our teeth, whatever happens with our teeth, just happens. Like if you were walking around breaking bones all the time or constantly fracturing or hurting your
Right?
bones inside your body,
Yeah.
you would
Mm-hmm.
doctors would be like, okay, you have to do something different, or there's
Yeah.
something wrong here. We have to address this. But why don't we go to the dentist and think, oh my word, my 5-year-old has 5 cavities? Or I go, and what has
Yeah.
changed in my life that I suddenly am getting these now? Um, I forget that they're bones, that like you can fix
Right.
bone problems in your body when you're at low calcium or
Yeah.
brittle bones. But why don't we
Yeah.
actively think about how to make our teeth
Because you
healthier?
can, I think, I think because you can just easily go to the dentist and they just fix it.
Right. It's so
But look,
interesting. I
I
haven't thought
cannot
this
tell
deeply
you
into
how
dental
many.
health.
Right? How many people are deathly afraid of going to the dentist? So those are the people, you people that are listening to this, that really are deathly, you need to be extremely proactive, fix your diet. You need to be taking better care, right? So that not, and I still think you'll need to go at some point, but and we're going to talk a little bit about that too, about if you're really afraid to go to the dentist and what to do there. So also you want to supplement, and supplement's not the right word. I would say if you have a tendency towards dental issues, um, take the cell salts, the 12 cell salts.
All of them?
And there are specific cell salts for specific dental things, but yeah, just once or twice a day, every day, all 12. Just do it, especially if you have that tendency. So I wouldn't say, if you don't have the tendency, then you shouldn't be worried about that and trying to go after cell salts, as a prevention. But I have had cavities since I remember a time when I was little. Every time I went to the dentist, I would have a cavity. So, I have a mouth full, and root canals before I knew, I didn't know any better.
Which
So
I hope we talk about
I'm,
later
I'm
because
one that
I
should
don't
have
know
been
much
using.
about root canals.
Yeah. Yeah. Don't, yeah. You need to get that tooth fixed before it turns into a root canal. Um,
I know.
so,
I know. I'm
and
overwhelmed. I
there's
don't know how to
not,
find a dentist. How many dentists is it going to take me to find one I like?
oh
You
man.
know, it's overwhelming, so I just don't start.
Yeah.
Classic Brie move.
Yeah. Well, I am just going to be really honest right now. I'm not super worried about going to holistic dentists. And I hope all of you didn't just turn me off and forget me forever right now for saying that. I've been to both. Find a dentist that you love, that makes you comfortable, that you trust. Nobody's using mercury anymore. My goodness. Really, if anybody is, then definitely stay away from them.
Yeah,
But
there you know for sure
like,
to
that's
not
not
go
going to
there
happen.
because they are 20 years
Right?
behind in their
Yeah.
technology.
If you go into a regular dentist that's not a holistic dentist and you tell them your concerns, that you don't want x-rays that are unnecessary, that you don't want fluoride treatment for yourself or your children, and if they are compassionate and listen and honor that, you're good. If
And maybe
and
that's
then
an
and then
area where
also, okay,
you go ahead.
no, we're lagging. Go ahead.
So I was just thinking about my experience, even in a hospital, giving birth in a hospital with my first and my third, vastly different experiences. And I think a large part of that was my own education and my own advocacy for myself.
Yes.
So
Yes.
I don't think everyone is out there to take advantage of us. Definitely the system as a whole, probably. And there are doctors who do and dentists who do. But I think if you go in educated, knowing what you want and what you don't want, that alone, I think will help you have a better experience. And
Yeah.
like you said,
Exactly.
finding one that will respect that and honor that. And even if you
And
disagree,
that's what mine does. I've been with them for years. I left them, went to holistic, came back. The holistic dentist, I had to pay out of pocket for everything, all this ozone treatment, all these things. It was super expensive, and and my regular dentist honors what my wishes, and they don't make me feel bad about it. They don't push anything. The only difference is when you're looking for a dentist, if you go to a dentist that's not holistic, when something happens, the treatment that they're going to offer is going to be different than a holistic dentist. So they're going to say, "Oh, you need a root canal," where a holistic dentist might do something different. So there's that to think about.
and to maybe consider what
So
you're
I'm not
willing to
telling you.
do. Just like in
Yes,
all of your health, you can
yes,
and should take it seriously. And maybe if it's a child having severe problems, I may be more willing. I mean, I would be more willing for my kids to go through a lot more work. I would change our diet
yeah,
dramatically and I would do all of those things to really set them up for a lifetime. Now for myself,
Yeah.
I know I will not stick to that diet, take 5 supplements 3 times a day
Right.
to fix this cavity. So instead of letting it rot out of my mouth, I do need to go get it taken care of. But I know that can become a really
So, in
touchy subject.
right. Yeah. So don't let it get to the point of losing that tooth. Is my advice to everyone. If you have a cavity that's not brand new and that's not very small, if it is very small and new, then use the remedies that we're going to talk about. But if it's bigger and you might be past that, still change your diet. That's still going to help slow down the progress. But definitely get it taken care of before you lose the tooth. Because if you're not going to get a root canal, the option is pulling it, and then you're without that tooth. So yeah, so just go get it taken care of. A little filling is not detrimental, when they use the right kinds of fillings. So that's yeah. Um, Wanted to also just talk about cell salts for dental health. Um, they support your health on a cellular level. So I'll have to cut that out. So they do that by replenishing required minerals, and in some cases, even dissolving and eliminating excess minerals that might be problematic for the body. This is your 12 cell salts. This is your Highlands bioplasma, or this is what I like to use for those of you looking at the video. So you all, these videos, this, if you're listening to this podcast, there's also a video that's of this podcast on the YouTube channel. So this is Highlands. This is what I love to use, and as far as all 12 cell salts together. So let's talk about the 3 cell salts that are crucial for strengthening and the dosing. So calc fluor, 3x or 6x are my favorites. Calc phos, 3x or 6x, and silica 3. I would say silica 6x or 12x. That's what I generally do. So that's number 1, 2, and 12. And when you're looking at the cell salt numbers. So calc fluor strengthens tooth enamel and can be used in place of fluoride treatment.
This is so good. When I saw this in your
fluoride,
notes.
yeah, right? Yeah. So fluoride, the fluoride treatment you get from the dentist is synthetic. It's a neurotoxin, and it's not the form that your body can actually even use. But calc fluor provides you with that form that your body can actually use. And then calc phos helps to strengthen your teeth and your bones from within, from the inside. And
so
then
they work in
silica
tandem.
also.
Calc fluor helps with the enamel. Is that remineralization?
Yep. Strengthens enamel.
And then
say that again.
Is remineralizing done from the inside though? So that would be more calc phos. I feel like maybe I can't remember.
Yes.
But like it remineralizes from the inside out.
I love that you just said remineralization. I love that you just said that. Uncle Harry's tooth powder is what I use to brush my teeth with. That is
amazing.
Remineralizing formula. Love it so much.
And you feel
They
it.
also have a little kit. Yes. So good. My dental health is so much better since I started using Uncle Harry's, Cocoa Floss, and Triology. Hands down.
I'm like going to get all of these
had
things.
Trouble all my life.
Okay. I'm making my little tabs on Google, ordering all of it.
Nice. Yes. I've been on the Triology monthly. They send it to me monthly.
Okay.
I'm just on the recurring thing for Triology. So for dosing, for maintenance, back up, remineralization. Uncle Harry's has a kit a remineralizing kit that can help you. So if your cavity's small, I would absolutely get that and use that along with this calc fluor, calc phos, and silica.
Okay.
So for maintenance, go ahead.
I was going to ask a question. You were getting
2
to
tablets.
dosing. Okay.
Sorry, we're lagging and
I know, we keep
Sorry.
interrupting each other.
That's okay. That's all right. So 2 tablets once or twice a day. Okay, let me back up. I would say 2 to 5 tablets. Those are those big chalky tablets, if you're talking about from Highlands.
2 to 5 of
Once or
each
twice
of
a day
those.
for of the calc floor, calc Floss, and silica.
That is a mouthful of
That's a
chalky
lot,
tablets for sure.
right?
But I mean, I
Yeah.
ordered the little guys from A to Z for one of my sons to
Yeah.
take. Could I
Yes.
make a tincture or water dose? Because I trying every single one.
That's a
I mean,
lot.
it is just a lot to do, and I mean, it's
Yes,
really
water
not
dose
that
it.
hard. But can I water dose?
Especially if you're trying to do your whole family.
Yeah.
That's gonna be you're gonna fly
like,
through
dun, dun.
those. Yes.
And just like opening
Yep.
and
I
closing,
would
like
water
getting
dose
all the
it.
kids to stand there and just like little birds with their mouths open
Yeah.
for 3
Yeah.
remedies. They're like
So
over it.
if you don't know how to water dose, then go to my YouTube channel and learn how to use a water dose, how to make that. And then so you do that 5 days a week, and then take a weekend off, or you can do it twice a day for a month, and then take a month off. I don't follow any very specific formula like that. I'm just giving you some guidelines because some people they need those specific directions, and that's okay. I don't do it that way. I'm very intuitive about my cell salts. I take them sometimes once or twice a day, sometimes a week might go by. But every time I think of it, I take them. Sometimes it's very close together, like I'm on this roll for a month or two, and then all of a sudden I just stop taking them, I forget. You can do it that way. But if you're trying to heal a cavity, you want to be more, more serious about it. So homeopathic remedies are so useful in dental and all kinds of dental issues. So you can use it before and after dental work. You can use it to ease anxiety before you go to the dentist. You can use it to reduce the tendency of issues after your procedures. You can use it to relieve discomfort after procedures. So first I want to just share my toothache. If you have a toothache, my toothache protocol is Hypericum 200, Arnica 200, and Pyrogenium 200, all mixed together in the mouth at the same time. You can make a water dose of this, or you can take 3 to 5 pellets of each one of those together at the same time. This is a toothache. This is a sharp shooting pain. This is the achiness, and the pyrogenium is in there for if you think that this is due to an infection. So if you don't think there's an infection, then maybe leave that one out.
So if my tooth is like achy because of the cavity, I could leave out pyrogenium. I don't think there's an abscess or anything. Yeah. It's just sore because it's growing.
Yes. Yeah.
Okay.
So do the arnica and the hypericum. If that's not really working, then add the pyrogenium, because you never know what's down in there. I mean, I'm sure you're right, but for listeners, also use that as needed. What I found in people that I've suggested this to, and in my family, usually one dose does it. Sometimes it takes a couple of doses. You can take this, every couple of hours if you're still in pain. I want to encourage you just to make your life easy. Start there. Do it. Okay. If that's not working, so we love protocols. If the protocol's not working, then we can dig deeper and go into other remedies. And aconite is a great one, another one to have. Chamomilla, gelsemium, pepper sulph. Remember, this is all transcribed, so if you need the spellings of these. Magphos, Staphysagria, and silica can also be helpful in pain. So those remedies, pepper sulph would likely be a 6C. The rest of them you could use in a 30 or a 200. 30C or 200C. and you can mix and match those. The way to decide which one to use is looking in the repertory at how those present. So first, let's talk about the different types of toothache. So okay, you've got decay, like what you're dealing with right now, Bree. If decay is causing the toothache, that's a one type of toothache. Abscess or infection is another type of toothache. Trauma, so if you've hit
Mm-hmm.
your mouth and then it causes a toothache. Maybe gum disease, exposure of a tooth root, eruptions, impactions. Some toothaches you need to go to the dentist for, and you need to decide when it's time to get help and go to the dentist. I love our dentist. I I want to stay away from there if possible, but we go and get our teeth cleaned twice a year, all of
Well, and
us.
if you're having an
Um,
issue, just like the Banerjee protocols, it can be beneficial to go to a doctor to get a diagnosis if you're unsure what's going on, or
mhm,
to even
true.
just have a launch pad. So even if you're going to the dentist, maybe not viewing it as they're going to fix it all for you, but to get more information, to investigate, like you said.
Very true. Yeah, very true. Yes, yes. You know what? I forgot to talk about investigating. We're going to get into these remedies, but you need, when you're talking to your homeopath or when you're trying to figure out for yourself which remedies to choose after the protocol hasn't worked, you need to investigate. You need to know what makes it better or worse. Does temperature make it better or worse? Does pressure make it better or worse? And then differentiate between, does it feel better when you lie on the left side, or does it feel better when you press on it? Those are two different things. Because
Hmm.
if you're lying on your left side and it feels better, it might be because you're pressing on it. But there are some toothaches that feel better from lying down. Most toothaches feel worse when you lie down. So if
Yeah.
you feel worse when you lay down, but it feels better when with pressure when you push on it, then you want to know that when you're looking through your repertory and trying to figure out remedies. You need to know again temperature, hot or cold, or tepid, room temperature water. Sometimes one of those can make it feel better. Um, Movement. So you need to know, if you are just walking and it makes it worse. You need to know that. If you are riding in a car and jarring, if that makes it
Mm.
worse. Those are all kinds of things. What makes it better or worse? What is the cause? Like we just talked about. What's the etiology? And rate it. Remember to rate your pain on a scale of 1 to 10, so that when you go to reassess your situation after your fourth dose, remember your four dose rule. After your fourth dose, then you reassess the situation and see if there's been any change. I do want to add that for toothaches, I would actually give it 24 hours before deciding rather than just 4 doses. So let's say you've got a really bad toothache and you decide I'm going to throw this remedy out every 15 minutes for an hour and you don't see any relief. I would be cautious about sticking strongly to the 4 dose rule in toothaches. So
Okay.
if you're just doing it a few times a day, to like, let's say you're just doing it twice a day because the toothache isn't that bad, then you're giving it 2 days and that's appropriate. So let's
Okay.
talk about. Go ahead. Did you have any questions or anything to? Okay. So the uncomplicated toothache, meaning there's not an impaction. It's kind of like what it's just a cavity, a small cavity. Um, Belladonna. Oh, the throbbing pain. So you need to be able to
Hmm.
describe the pain. Is it sharp shooting? Is it throbbing? So belladonna has the throbbing pain that's worse from touch or motion. So you can't chew on that side. That makes it hurt worse. Magfoss is worse from cold, better from warmth. So you might, if you don't know how temperature affects it, you need to test it. So whether that's putting cold water or warm, I know.
I
When
know
I
it's
thought
gonna
of that,
hurt.
I'm like, oh
Like
Cold
cold, I
always
know
hurts.
cold is gonna hurt my teeth.
Yeah. I hate when the dentist says we have to test it to make sure we're doing the right tooth, and they put that freezing cold
It's like
swab
ice
on it, and
cold,
it
and I'm
sends
like,
this pain through my
dude,
body.
I know.
I'm gonna die. Yeah.
Yeah.
Even if I didn't have a
Like you
toothache
just
or a
froze my
problem, that would
actual
hurt my
brain.
teeth. Brain. Yeah. So, but you could also do like a warm compress on the outside to see if that helps it feel better or makes it worse. So Magfoss is worse from cold, better from warmth. Coffea cruda is one I didn't mention just a minute ago. That one is worse from heat, better by holding ice in the mouth. Can you imagine? I
I
don't know if I've
only
ever
can
heard that, but
imagine
there might
pregnant.
be
And that otherwise
real. Oh, okay.
oh my word, I cannot do that
Kill
when
me.
I'm not pregnant.
No.
Nope.
Chamomilla is worse from warmth, but not better with cold. So those are just a few differentiations for the uncomplicated toothache. In dosing any of those remedies, in general, you're going to use a 30 or a 200C, and you can dose this every 30 to 60 minutes or as needed. Always stop when you're very much better. Don't keep taking remedies when you're very much better. So let's say you're just like, well, I know this toothache's going to come back. Fine, take the remedy again when it comes back, because
Okay.
it literally could be weeks or months before it comes back. This is how homeopathy buys you time. I have held off a procedure for 2 years with homeopathy before. Now, I'm not suggesting that you do that if you have a cavity. This was a procedure. There was nothing, and you have to watch for infection. You don't want things to get infected. So probably really shouldn't have just said that. But that was myself, my body. I know what's going on in my body. I pay attention to it. I safely did that. That may not be true for everybody in every situation. You have to have discernment. So infections and abscesses are complicated toothaches. And you really need to see a dentist. If there's an abscess, if you see a white bump in your mouth on your gums next to your tooth, if you're swollen on that side, around it, you need to get to a dentist. So the Pepper salt that I mentioned in a 6C is great for dental abscesses. So you can use this especially when there's cold sensitivity, increased salivation, sore gums, worse for touch. Use it in a 6C, which promotes and supports drainage. So because when you get that abscess or that bump in there to drain, that pressure goes away and the pain goes away. You still have to get there. You still have to go get it checked out. But that's also what pyrogenium does in my trio.
Okay.
It causes your body to reabsorb the pus, which is pressing on nerves, causing the pain. I know, right?
That's pretty nasty. But
So,
whatever has to
yeah.
happen. Would you take pyrogenium
That's
then
right.
in place of Hepersulf 6? Or would you ever do both?
No, yeah, definitely wouldn't do both.
Okay.
So I have always used pyrogenium. I've never used Hepersulf. Hepersulf is more commonly used. Most people go with Hepersulf 6.
Okay. Is
So
that a Banerjee protocol?
Also, the Hepersulf 6, maybe.
For dental, or maybe we just talk about it in the gateway classes.
Yeah,
it may not
possibly.
be a Banerjee protocol. Okay.
Right. So if there is swelling but no drainage, you can use a 30C or 200C in the Hepersulf 2 or 3 times a day. Okay, if there's swelling and but no drainage. And then silica is used more for chronic root abscesses. So it's useful when pus is draining. And this is goes back to that prevention that we talked about. So if you're one that has lots of trouble with dental things, especially abscesses, you can use silica as a prevention, or to uproot that chronic tendency. So other remedies for infection and abscess is belladonna. It's for an early root abscess, redness, and intense throbbing pain. Remember, belladonna always has the throbbing pain. Merc Sol, which is interchangeable with Merc Viv, so whichever one you have, is very sensitive to hot or cold. And the pain might be worse at night. So that would be a differentiation of the remedies. Myristica is especially suited to wisdom teeth. My dog's farting.
I saw
Oh
your
my
face and was
gosh.
like, what is going on?
Oh,
Honestly, dog farts are the worst. I hope you keep this on the podcast also, by the way. I'm just kidding. No, keep Make sure you, these
maybe
are
I'll keep it on the
bloopers.
video because people can see me.
Yeah.
Yeah. Oh, that's good. We need bloopers.
Wait, I know, I just thought
Yeah,
of
I
that
turned my
actually. We should
fan
do
on.
bloopers.
I had to turn my fan on to blow towards her. Look at her.
Oh, look. Oh, it's not.
She's laying down there farting.
It's not a little trigger. Look at her.
Puppy.
Look at her little nub
Oh, she's
tail.
doing it again. Okay. I'm going to have to pretend like I don't smell anything. Okay.
Poker face.
Calendula tincture. Really, really love calendula tincture. You can make a rinse with it on 1 to 20 ratio. So 1 drop of the tincture in 20 drops of water. And rinse with it after dental procedures like extractions. It can really help to prevent infection. So use it as a mouth rinse. But you can also just do this every day. You can use calendula as a mouth rinse instead of the Triology if you wanted to. So if
I'm going to compare them.
You go on. Okay. Well, yeah. If you're going to go on to Triology and you look at the price and you think, oh, I can't afford that right now, get you some calendula mother tincture, herbal tincture, and dilute it and use it as a mouthwash. You can absolutely do that. And you can do that several times a day, especially when you're having trouble. You can also alternate calendula tincture with warm saltwater rinses. So, let me not waste my fan power on her if I get hot again. Okay, so trauma or surgery. I always have people use arnica before they go into the dentist and right when they come out, always. Not just for cleaning, but any procedure. Okay. So before and after dental surgery, or if you've had a trauma to your teeth, then bruises or fractures, sore spots from ill-fitting dentures, arnica can help.
I wonder if that would also be good. Nerve. Sorry, I know we're lagging. A friend of mine got Invisalign recently, and the bottom was pressing on her gums. So even maybe that.
Yes, absolutely. Definitely good, very good. Braces. Arnica would be great for braces when there's all that soreness, especially when you go and get them tightened. So hypericum is always your nerve remedy. It's your nerve pain. So there may have been an injury or a deep filling. You can mix this with arnica. And hypericum is great for injuries to the front teeth because the front teeth have a lot of nerve. Maybe a lot more. But what I want to say about, I want to just give you my recent example. I had a cracked tooth and I had 0 problems with it. It wasn't causing me any pain. There was nothing wrong. But the dentist kept seeing it and she kept saying, we need to put a crown on this. We need to put a crown on this. And I knew she was right, but I'm busy and I didn't feel like it. I'm not afraid of the dentist. I don't have the dental anxiety. I was just, and you would think that I would with all the stuff, all the things I've had done at the dentist, but maybe that's why, because I've been at the dentist having stuff done since I was little.
Anxiety thinking about it because I've never had it done. So it scares me.
So you don't even, we reject that right now in the name of Jesus. You do not have fear. There is nothing. There is literally
I do not have
nothing.
fear.
There's no pain. You do
but
not
they
have
talk
fear.
about they're going to give
I forgot. You have never even had.
No, they're going to give me a shot. I know it in my mouth.
They numb it first.
No fear. I don't have fear.
They numb it first. You don't feel the shot.
I'm not scared.
So that's where people are afraid is the shot. Do you know I never even knew that I got a shot until I was like in my early 20s. And somebody said something about they hated, that was the worst part. They hated getting that shot. And I was like, I've never had a shot. And they were like, Melissa, yes, you have if you have cavities. I was like, no, I've never. Do you know my dentist would come from behind? He would numb it. He would come from behind me. I never saw what he was doing. I never saw. So if you have a good
Wow.
dentist, especially for your children, you're not going to see that ginormo needle.
Well, you just told me
Sorry.
now, so there we
You
go.
don't feel it. You don't feel it.
Okay, I trust you
You
a
literally
lot.
don't feel it
So
because they numb it.
if I feel it, I'm coming back,
So
and I'm
if
gonna be
you
mad.
feel it, then you need to tell your dentist, I need more topical.
Okay.
And you can go in and say, I want extra topical. I do not want to feel that.
Okay, I'm gonna say
Telling you,
that.
you're not going to feel it if they do it right.
Gosh, I'm getting nervous
I've never
thinking
felt
about
it.
it.
And
Not-
I'm really sensitive to pain. I have a low pain tolerance. I don't even have tattoos because I'm afraid of pain. I want
Okay,
tattoos.
that is encouraging.
Okay.
Seriously. Okay, moving on from my fear.
Yeah. Yes. So, but that's going to speak to a lot of people. A lot of people have
True.
that fear. Okay. So, all right, Magfoss. Magfoss has the sore, stiff, cramped jaws after a prolonged dental visit. That has happened to me before. And Magfoss is better with warmth. Next is Leadum. Okay, so you always want to take Leadum after your dental visit when there has been a puncture. So when you have to have a shot, when you have to have a shot of any kind, anywhere in the body, anytime there's a puncture, which includes the shot, Leadum. It's going to help with soreness. It's going to help prevent infection, and it can help lower that or prevent. So if you take arnica and Leadum before you go into the dentist, you're not going to feel as much as you would have, I guess, if you didn't. And then you take arnica and Leadum again when you leave the dentist, only when you've had to have a shot. Chamomilla is an excellent antidote for local anesthetics. But listen, don't take chamomilla just because you've had to have the local anesthetics. Take chamomilla if you're having trouble, if you're having symptoms from the local anesthetics, which I've never had. I've never had symptoms. And I know that that's not everybody. Everybody's different. That's the puppy. You can take it every 15 minutes to reduce numbness after dental treatment. Okay, there's that. So, I never even thought of that. I never even thought of the fact that I stay numb forever. I stay numb for hours, and that's not really normal. You really shouldn't stay numb that long. So that would be a reason to use chamomilla. I think I've just done that all of my life, and I'm just like, oh, this is just the way it is. But really, it should wear off. Like the dentist will tell you, this will be worn off in an hour or two. It's like 5 hours for me.
Wow. Try this next time and see if it works.
I am going to try it next time. It's awesome. So Staphylococcus aureus helps incision wounds. So anytime you've had to have a tooth extraction, that's when you're going to have an incision because they have to cut. So after that soft tissue surgery, such as an extraction, and impacted wisdom teeth or periodontal surgery, Staphylococcus aureus is great for that. So let's talk about anxiety before the dentist. So we are flying through this because we don't want this to last forever. And I have 10 minutes left. Oh, okay. So anxiety, aconite. It can be taken before you go to the dentist. It can be taken along with or alternating with gelsemium for that anticipatory anxiety. So if you have a dental appointment coming up next week and you're feeling anxious about it now, take gelsemium twice a day. I would say like a 30C. Take aconite 30 or 200 once or twice a day, leading up until to the dentist visit. Those are my favorites. Oh, that's it. That's the end of our little notes.
I was going to say, I think we made it through everything.
A few minutes. We did good. We did really good. I didn't realize that was the last one. So, so what I want to encourage you in is to use homeopathy for your dental issues, but use fix your diet also, because that's where it's going to stem from. You I don't want people thinking that you can just do whatever you want to do. I never want, it doesn't matter dental issues or not. I never want people to think, oh, I can just eat whatever I want because homeopathy is going to take care of whatever. With structural issues, homeopathy can't fix structure,
Mm.
and often dental issues is a structural thing. So it can help. It can buy you time until you get to the dentist. In a very small cavity, it can, and using diet and maybe the Uncle Harry stuff, it can help remineralize and maybe you could get it fixed. But and also prevention. Homeopathy is great for prevention, but you can't go around eating sugar every day and taking cell salts to try to prevent. You gotta, right?
Yeah.
You gotta do your part too. So I hope this was helpful. And I know it was a lot. Go back and listen to it again. Look at the transcription. Take some good notes. Make some comments. Let us know what you need. Let us know what questions you have. I would love to see comments on questions. I would love to answer those. And join us in a class. We teach, we have a whole chapter on, or whole week on cell salts in our Gateway 2 class. And we really dig deep into the cell salts. But what I would encourage you to do is take a Gateway 1 and 2 class, then join me in the mentorship program, and really just dig deep into learning how to do this for your family.